meeting of the Health Standing Committee on Health Services. I think we have folks still rolling in, but DJ, if you could please take the roll. Get started.
Representative Bentley. Yes, sir. Representative Bratcher. Here. Representative Bray. Representative Burke.
Here.
Representative Callaway.
Present.
Representative Camuel.
Here.
Representative Duval.
Here.
Representative Frazier Gordon. Yes. Representative Justice. Representative Neighbors.
Here.
Representative Rayburn.
Here.
Representative Raymer.
Yes.
Representative Riley.
Here.
Representative Rourks.
Here.
Representative Sharp.
Present.
Representative Wilner. Representative Whitten. Vice Chair Dotson.
Here.
Chair Mosier.
I am here. Okay, we have a quorum established to do business. We're going to go ahead and get started. We have a pretty hefty agenda today. The first bill I'd like to call is House Bill 170. Representative Roberts and Justice Keller, if you make your way to the table, introduce yourselves for the record and go ahead and proceed.
Representative Rachel Roberts here on House Bill 170. And
Thank you. I'm not in my element here. Chairwoman Mosier, it's good to see you, and thank you for the committee allowing me to appear. And I'm here to answer questions, but not in taking a policy position, but I appreciate being here. Thank you. Michelle Keller from the Supreme Court.
Thank you.
Chairwoman Moser and distinguished members of this committee, thank you for the opportunity to bring this bill before you, a bill that will help cancer patients and those with disabilities throughout our Commonwealth. House Bill 170 is essentially a conforming language bill. It would bring our state law in line with federal law, specifically the Americans with Disabilities Act. The Americans with Disabilities Act was first passed in 1990 and was amended by the Americans with Disabilities Amendments Act of 2008 under then President George W. Bush.
Motion on the bill.
Okay, we have a motion and a second. Do we have any questions or concerns? Well, see none. I'm curious if you could just give a quick, tell us the story that brought this to your attention, and then we'll go ahead and take the vote.
I believe it was our opinion in the Joyce Turner versus Norton Healthcare case, which was rendered in 2022, and whether the KCRA is amended to adopt the federal ADAAA would not have changed probably what happened in that case because of factual issues. The court did alert the public at that time that it was unclear whether the KCRA fully embraced the ADAAA, which were the amendments that Representative Roberts just spoke of. So as a matter of staying in our own lane in the third branch and understanding that you as the policymakers would be the best voice to make that explicit adoption, we did alert in that opinion that we felt it was time to perhaps bring the KCRA in compliance with the ADAAA. And I can answer any questions.
Thank you. I appreciate that. We have one question from Representative Bentley.
Thank you, Chair Lady. The basis for this is from the Federal Civil Rights Act, right? Is that where it starts with?
It's actually the Americans with Disability Act that was originally passed in 1990 and amended in 2008, as Representative Roberts indicated during the Bush administration.
I must be reading this wrong then. Federal Civil Rights Act of 1964 is amended by Title 8 of the Federal Rights Act of 1968. Was that the grounding for it?
I think if you're asking about the Kentucky Civil Rights Act, the answer would be yes.
My point is, how many people were discriminated against until we brought this up today?
I'm not sure I can answer that with a specific number, sir, but I will tell you that I have brought this bill today because I think it is important for cancer patients and everywhere who have a disability but still want to be able to work within the state. And it is a conforming language bill, so this is simply putting us in line with the federal regulations.
Thank you, Chair Lady.
You're welcome. Okay. Seeing no further questions or commentary, we will go ahead and take the roll.
Representative Bentley. Representative Bratcher. Representative Bray. Representative Burke.
Yes.
Representative Callaway.
Yes.
Representative Camuel.
Yes.
Representative Dotson.
Yes.
Representative Duval.
Yes.
Representative Frazier Gordon. Representative Justice. Representative Neighbors.
Yes.
Representative Rayburn.
Yes.
Representative Raymer.
Yes.
Representative Riley. Representative Rourks.
Yes.
Representative Sharp.
Aye.
Representative Wilner. Representative Whitten. Chair Mosier.
Yes. Okay. House Bill 170 passes with favorable expression. The same should pass on the House floor. Thank you so much for bringing this, and it was great to see you, Justice Keller. Thank you for being here.
It was great to see you all. Thank you for your service.
Thank you.
Thank you to the members of the committee for support of this bill, and I would invite any of you to co-sponsor it who might like to. Thank you.
Thank you. Okay, we are going to skip ahead to Senate Bill 89 as the bill sponsor is toggling between committees. And I think we have some of the members of this committee doing the same. So Senator Funke Frohmeyer, if you could just introduce yourself for the record and have your guest introduce herself, and please proceed.
Thank you, Chairwoman Mosier. My name is Shelley Funke Frohmeyer. I'm a state senator from Campbell, Pendleton, Bracken, northeast corner of Kenton.
And I'm Mary Catherine Deloder with the Kentucky Birth Coalition.
We're bringing Senate Bill 89 to you today to recognize that there are women that are on Medicaid and they're pregnant. They're considering how to be maybe as holistically healthy as possible, and they're pursuing a more holistic home birth option. They are currently, but this would expand the possibility to use Medicaid coverage for a home birth. Right now it's available in a hospital-based birth, but this would offer that if you're going to use a licensed practicing midwife. I'm going to turn it over to Mary Catherine.
Thank you.
Motion on the bill.
Okay, we have a motion and a second on the bill. Do we have any discussion? Okay, we have a question from Representative Bratcher.
Yes, ma'am. I'm hidden over here behind this guy here. I'm just teasing. But thank you, Chair Moser. I just had a question. There seems like there's some confusion about a nurse that is a midwife and the person that's non-nurse midwife, and the consumer gets confused about the level of expectation and the level of medical care they can provide. And so can you elaborate a little bit on the differences and which one has maybe a higher level, and how we can communicate to our consumers that want these services, that they're getting the right person for them that fits?
Sure. So there are two types of licensed midwives recognized in Kentucky. One is an APRN, who is a nurse who then pursues additional midwifery education. So they have sort of training in two professions, so to speak. A direct entry midwife, which we title as a certified professional midwife here in Kentucky, is someone who goes directly into the profession of midwifery without first being a nurse. So they both receive midwifery education. It's just that one happens to also be a nurse. In the law that was passed to license the certified professional midwife, part of the disclosure that they are required to give to every client is a description of their education and credentials at the outset of care. It can be very confusing to talk about the different types, but in terms of the care that they receive at a home birth, CPMs are the only type of provider that are specifically trained in the out-of-hospital setting. So we have a few nurse midwives who do also attend home births. They are not trained in home birth. They are trained in hospitals. So they will often go and partner and work under a CPM to learn the ropes of how to work in that environment.
Thank you, Chairwoman.
You're welcome. Representative Dotson.
Yes, thank you, Chair Lady. Just a question. I'm in support of the bill, but cost-wise, having a pregnancy and a birth in a hospital as compared to at home, is there a cost comparison there?
There sure is. I'd like to address that. We did ask for a fiscal note on Senate Bill 89, and the fiscal note came back at about 175,000 from the state and about 300,000 from the federal. If there's a need to transfer potential, because they're being paid for by state and federal dollars. But the recognition in my own family, my daughter had a home birth back in October and a home birth 3 years ago. And the difference is about $5,000. So what she paid for her total care in her home birth was about $5,000 less than what she paid in her Christ Hospital bill. That's not always the case, but that's about average.
And I would just add that there's no facility fee in a home birth, so that would be a difference as well.
Yeah.
Okay, thank you. Okay, see no further questions. We will go ahead and take the roll.
Representative Bentley. Yes. Representative Bratcher. Yes. Representative Bray. Representative Burke.
Yes.
Representative Callaway.
Yes.
Representative Camuel.
Yes.
Representative Dotson.
Yes.
Representative Duval.
Yes.
Representative Frazier Gordon. Yes. Representative Justice. Representative Neighbors.
Yes.
Representative Rayburn.
Yes.
Representative Raymer.
Yes.
Representative Riley. Yes. Representative Rourks.
Yes.
Representative Sharp. Representative Wilner. Representative Whitten. Chair Mosier.
Yes. Okay, Senate Bill 89 passes with favorable expression, and the same should pass on the House floor. Thank you very much for bringing this, and good to see you, Mary Catherine. Thank you. Of course. Okay, next we are going to hear House Bill 764. If Representative Duval and any guests would make your way to the table.
Representative Robert Duvall, District 17, Warren County.
Sarah Cooper, Executive Director of the Office of Legislative and Regulatory Affairs with the Cabinet for Health and Family Services.
And David Lovely, Acting Inspector General at the Cabinet for Health and Family Services.
Okay, thank you for being here. Please proceed.
Chair Moser, members of the committee, thank you for the time to share today. House Bill 764 addresses problematic issues the Office of the Inspector General has encountered as it's implemented the CASPER program, and these changes cannot be accomplished through regulations. Similar language was included in House Bill 290, which passed the House 98-0 in 2023. There's only one difference between last year's bill and this proposal. It addresses the definition of practitioner in Section 2, subsection 40. Other cleanup items in the bill: one, it exempts providers who are engaging in charitable health care services from e-prescribing, which is a very expensive procedure, or very expensive, so it's going to be a cost savings for them. It requires practitioners to register with CASPER. It gives the authority of the Cabinet to share CASPER data with federal entities involved in military bases particularly, and it actually removes outdated language that does not reflect the current drug schedules.
Okay, we have a motion and a second. Do we have any discussion? Okay, seeing none, DJ, please take the roll.
Representative Bentley. Yes. Representative Bratcher. Yes. Representative Bray. Representative Burke.
Yes.
Representative Callaway.
Yes.
Representative Camuel.
Yes.
Representative Dotson.
Yes.
Representative Duval.
Yes.
Representative Frazier Gordon. Representative Justice. Representative Neighbors.
Yes.
Representative Rayburn.
Yes.
Representative Raymer.
Yes.
Representative Riley. Yes. Representative Rourks.
Yes.
Representative Sharp. Aye. Representative Wilner. Representative Whitten. Chair Mosier.
Yes. Okay.
Thank you.
Thank you.
House Bill 764 passes with favorable expression. Same should pass on the House floor. Thank you very much.
Thank you.
All right. Okay. Next, I would like to hear House Bill 252. Representative Stalker, just introduce yourself for the record and your guest, and please proceed.
Thank you so much. Good afternoon. My name is Representative Sarah Stalker, and I represent the 34th District.
Good afternoon. I'm Corey Meadows, and I am Director of Advocacy for the Kentucky Medical Association.
Thank you for allowing me to present this important piece of policy. I want to thank the 25 individuals who have already come on as co-sponsors and invite anyone in this committee who hasn't already joined to please see this as an open invitation to co-sponsor. We do have a committee sub.
We have a motion and a second on the sub. All in favor of adopting, please say aye. Any opposed? Okay, thank you.
Sure. Just to be clear, the sub only provides more explicit and clarifying language as to not create any sort of confusion for our doctors. Obviously, my guest here is Corey Meadows. He's with the Kentucky Medical Association, helped with the clarifying language, and is available to answer questions if that's needed. So I just want to start by saying the goal of this bill is twofold. First, it's to protect our patients who might be going underneath surgery that requires an anesthesia. The second is to support our medical students who need to be confident and comfortable giving exams knowing that they have patient's consent prior. We will accomplish this by requiring patients to sign a separate form from the general consent form that they sign prior to going into surgery. And this would allow them to give consent to having an intimate exam for the educational purposes only for med students while they are in that surgery. So in this bill specifically, I hope you notice that intimate consent is covering pelvic, prostate, and rectal exams. It was important to me that if we were going to put this type of legislation before the body, that we cover all of those bases. This bill does have the support of the Kentucky Medical Association, the Kentucky Nurses Association, which you should have a letter of support in your materials, as well as RAIN, who sent a letter of support as well as a one-sheeter. And for anybody who's not aware, RAIN stands for Rape, Abuse, and Incest National Network. They are the nation's largest anti-sexual violence organization, and they created and operated the National Sexual Assault Hotline.
Okay, we have a motion and a second on the bill, and a question from Representative Sharp.
Thank you, Madam Chair. I'm trying to understand this bill. We talked a little bit before the committee hearing started. You're codifying basically an assault happening underneath somebody under anesthesia, correct?
Correct. But to clarify, it's not currently seen right now as an assault. While many people in this room would assume for it to be an assault, historically the medical community has not viewed it as that way. No. So while I appreciate a motion on the bill, and I know the rule is to be quiet and to answer questions, if I could go through just a little bit more material, I think some of the questions that people in this room have could be answered.
Well,
but
if you need to do that to answer the question.
But if my previous response has not sufficed, let me know, and I can continue, and then we can circle back to that as well.
I'm okay with that, Madam Chair.
Okay, all right, thank you.
Wonderful, thank you so much. States are already moving towards this type of policy. We have 25 states that include Texas, Florida, Illinois, Virginia, that have enacting laws requiring explicit consent for intimate exams on a patient under anesthesia. And I'd like to see Kentucky join that group of states. I think it's important to say that the American College of Obstetricians and Gynecologists, many people know this organization is ACOG, they have stated that if exams offer a patient no personal benefit and is performed solely for teaching purposes, it should be performed only with her specific consent. So they have already come out in front of this, and I think that is largely due to the amount of states that are moving to put explicit policy in place to make sure that this practice either does not continue if it is happening in their state, or to prevent it from happening. While the exact numbers, a lot of people have asked me how many people are affected by this. And while those exact numbers are hard to pin down because patients are often unaware, there was a recent study that estimated that more than 3.5 million men and women may have received an unconsented intimate exam within the past 5 years, and that was through the Hastings Center. So another question that I've received from people is, how has this been allowed to happen? It seems very out of step for medical practice. Historically, allowing medical students to perform a pelvic exam, which is an essential skill that students it's been seen as a practical and efficient way just to simply teach them. However, there is really a disconnect between a lot of people within the medical community who see this as normal and non-problematic, and people who are patients, med students, or members of the public who see this as a disturbing violation. PBS did an incredible, maybe it was a 6-minute segment on this issue, and there were some really important pieces that came out of that I just wanted to cite. There was a couple of quotes that I just wanted to pull, that there was, by a young lady said, "There is pressure to perform these exams by our seniors, by our residents, by our attendings, and we are not comfortable with the exam. It is difficult to say no, and as a student, I'm not comfortable performing exams that are unconsented as are many of my classmates." So that was Dr. Alexandra Fuente, a med student out of the Ohio University, who's done several interviews on this. Also on that segment through through PBS, there's been some good information that was provided by Phoebe McGill. She's a bioethicist at McGill University who's written and studied and talked about this practice. And the way she phrases it is interesting. She says it's really the hidden curriculum in medicine. A lot of especially moral practices are learned through observing what physicians around you do, how they speak to patients, how they joke about patients, and how they think over time. You inherit the norms of of that world that you're entering. Like any career, there's all sorts of justifications for it. It's about being part of the team. There's the matter of that the consent covers all of us. And she says, I think that it's a norm that has stuck around and is now starting to really be questioned. So there's all sorts of additional material that I'd be happy to follow up with this group on as far as the coverage this has been receiving nationally. But I think it's important that, understanding that historically allowing medical students to perform a medical exam, which is an essential skill to the students, seen as a practical way for them to understand. They have to learn somehow. And most people are completely comfortable, if asked, allowing a student to provide some sort of service for their learning benefit. What this bill does is simply ask that there is written consent prior. So this would be a separate medical form from the general consent form that you sign when you go in for surgery. There are certain physicians who feel like the general consent form covers everything and that there's not a need for the second one. And there are other people in the medical profession who have pushed back against this and said that this is very much a separate issue. If you were to go in for a surgery and a physician were to find something while in that surgery close by that was problematic, that's what that general consent form does. It allows that physician to note that that there's another issue in there unrelated to necessarily why you might initially be in there, and that general consent would allow them to potentially go ahead and take care of that issue while you're on the table versus having to close you up, have you come out, of recovery and then say, oh, by the way, we found this additional issue in there and we didn't take care of it because, we wanted to make sure that we had your consent. That is what that general consent form that everybody signs takes care of. It says if you're in there and you see something, the doctor has that ability to make that judgment to go ahead and take care of it. This is very separate. This is strictly for learning purposes. This is for educational purposes of our med students, which we definitely want to ensure they get. But we as patients and med students are insisting that there is prior knowledge and written consent before this were to take place.
Okay. Thank you. That was very clear. And I think that we all understand that if there's a compelling need during surgery, it's still allowable under the general consent. And this also does not create any penalties. That's not what we're doing here. It's just the informed consent.
Correct.
Okay, yeah. And I don't want anyone out there to think that this, across the nation, apparently there are instances of this, and we need to clarify that, this practice be allowed under controlled controlled conditions. But yeah, I don't want anyone to think that, this is a routine kind of situation. So we have a question from Representative Bentley.
Thank you, Chair Lady. Have you talked to any of the professional licensing or certification boards about the penalty if this was proved under Section 2 to be a penalty?
I have not. I will defer to Mr. Meadows.
I haven't either. However, I think it's not necessary to write in a penalty on this. If you violate this statute, I think the ordinary recourse that you have available, whether that's taking it before the Kentucky Board of Medical Licensure for violating a statute, would be available to you, as would your ability to bring a lawsuit, just like you could today. In other words, I don't think it's necessary that you put in a private right of action specific to this bill. You would still have available to you your ability to sue or to take them before their respective licensure board, as you would in any other circumstance where you've been harmed.
May I ask that question, Chair Lady?
Of course.
With the student, how do you enforce that then?
Well, if I understand your question, the student is not operating on his or her own. They're with, they're going to be with another physician. The other physician or physicians would bring them into the room, as I understand it, to perform one of these examinations under the direction and supervision. In fact, I think there's language in the bill that talks about, the healthcare provider that is leading this must be the one authorizing or supervising this action. So this would not give medical students the ability to just unilaterally on their own and individually to do this.
In conclusion, we're voting on the bill. We don't know what the penalty will be.
No, I would disagree. I think you do know what the penalty would be. If it's violated, you can bring a lawsuit saying that this statute has been violated. I have been, assaulted or what have you. Or you could take them before the Kentucky Board of Medical Licensure to have them sanctioned for violating this statute. Again, I don't think it's necessary to draft into the legislation specific penalty. I think you've got recourse already available to you if you violate a statute, as you would in any other situation.
Thank you.
You're welcome. And I would agree with that. The licensure board has any sort of jurisdiction over dealing with malpractice. So that's what this would fall under. Representative Frazier Gordon.
Thank you. You had referenced a letter in support from KMA, and I don't see that in my packet. And so I just wanted to get Mr. Meadows' comments, if you could just make a statement on the need for the bill.
Yeah. We appreciate Representative Stocker approaching us because we wanted to make sure that the language was as clear as it could possibly be, because there is value in students and other healthcare providers performing such exams. You can't perform exams on a cadaver, if you will, like you can practice other procedures. You can't practice on a mannequin. Unfortunately, for these types of examinations, you need live human beings. And so our involvement was meant to help clarify the language and bring balance to where both those types of exams could be performed by those who are learning and who will be able to treat any one of us if they're called to do one day, but also to adequately balance that with obviously bodily autonomy and dignity, in that knowing that the patient, if they're going to undergo this, they've been approached with this and they've given their consent to know not only that the exam is going to be done, but know who's going to be in the room and who could be doing it, which is a part of the legislation as well. So that was our role in this, and we've been happy to participate.
And the letter that you have is from KNA, the Kentucky Nurses Association, as well as RAIN, the national organization.
Okay, thank you. Representative Dotson.
Thank you, Madam Chair. This kind of blows my mind because you really don't know this type of stuff exists, but just sitting here thinking, listening to your testimony, with this informed consent form, is it specific in that saying we've got 5 students that will be possibly doing a pelvic exam? I know I would personally have a problem if I had 10 students lined up to do an exam, and I went in for shoulder surgery and came out, feeling terrible. So my thing is that form specific, or can it be made specific to say we've got 5 students that want to do a pelvis exam? I'm just throwing this out there.
Fair question.
I mean, because there's a difference between 1 or 2, 5 or 6, especially for you ladies, and for us guys on the prostate side. It could be, you just want to be specific, I think, when you're looking at this informed consent form.
Would you like me to do it? I'll start, and then I may punt the ball over to Mr. Meadows as well. So it outlines the informed consent and what that needs to include on the first page here. I don't believe that anybody is going to allow 5 individuals to do an exam. It's a valid question, but the description outlines, the natures and the components of the exam, the treatments. I would have to consult with a physician unless Mr. Meadows knows right offhand how that might be limited in a surgical room.
Yeah, I'm not familiar with the exact process and procedures and whether they normally put a cap on the number of those who could participate in such exams. I will reference, I think the committee sub under informed consent talks about in the course of the discussion that you have with the patient, explaining the details and the nature of the examination. It does say that conversation includes the identity and training status of individuals, including students who may be involved in their care. In the form, it then talks about the form including the elements of that conversation that you had. So I think naturally, as a part of the form, you're going to outline those students, both to protect them.
Maybe we forgot to pay the electric.
Hope that's not because of my testimony.
Well, we are passing the budget. All right. Okay. Thank you.
That's still for that long.
So, in conclusion, maybe that was the cue. I think in that form, they would also outline those medical students and other personnel who would be involved in that. And I think that would both protect the supervising physician, also those who would be in the room and performing this.
And I agree. Madam Chair, the problem I have is just, even with the informed consent, it could be so vague in itself if a patient is not made aware up front. So I just, if that form, I don't know, could be more specific, I just think that, but I definitely support the legislation. Thank you.
Thank you. I think that raising this level of awareness to our providers is going to drive them to have specific conversations. So, last question, Representative Sharp, one more time.
Thank you, Madam Chair. As I've consulted with my wife, who's a doctor at a teaching hospital, and my daughter, who's third-year medical student, and as I'm seeing this, it sounds to me you're either trying to put the doctors on notice or you're giving them a vehicle to conduct these exams, because they're saying that this just does not happen right now.
So I would say this could be, it's probably twofold. I think what a form like this would allow would be to protect our medical students who could be put underneath this situation. So I have had during some of our advocacy days.
My daughter's saying that doesn't happen, and my wife is saying that doesn't happen. So my question, I guess, to narrow it down is, are we trying to give doctors a vehicle to conduct these exams that are currently, at least in 2 facilities I'm aware of, not being done?
Sure, go right ahead.
It's not giving them a vehicle. It does happen. It's not, it has not been explained to me by our leadership. I've consulted with our leadership on these matters, and they have confirmed it does happen. It may not be every day in every facility, but as medical students are trained, and I'm not sure what year that would happen, but they are trained by doing some of these examinations. So I do want to be clear, regardless of the frequency in which it happens, this is not opening a new avenue to do that. In fact, a simple Google search will show you that other states are taking this action because there have been some issues in other states where patients have found out and they have complained that they did not know. So it is a practice. I won't be specific to how regular the practice is, but it is a practice. But if you don't take anything else from what I say, this is not opening up a new examination opportunity for physicians. No.
Well, that's kind of how I'm understanding this. The other issue I'm having is I have seen some instances that have happened in the OR that don't get reported criminally, and they end up going civilly. And one of them was a nurse that was assaulted in an OR, and she ended up suing the doctor and getting $40,000. I don't understand why that was not investigated criminally. And from listening to what we're talking about here, you're talking about lawsuits and all this. If someone is assaulted during an operation, that's clearly a criminal matter. It should be reported that way.
And I'm sure that option would be available to the person who was assaulted. I'm not familiar with what case you're talking about, but oftentimes when you are assaulted, you speak with an attorney, and oftentimes you evaluate. Are we going to go the civil route, or are we going to go the criminal route? And so those determinations are made on a case-by-case basis. And so, if someone is assaulted, they would certainly have both of those avenues available to them, and it would be their choice upon consultation of a legal counsel on what to take. But I'm just not familiar with the case that you're talking about.
Okay. Thank you, Madam Chair.
Thank you. Okay, one last question. Representative Callaway.
Sorry, that conversation sparked a question for me. So we are hearing some conflicting stories. So I just wonder, and obviously I'm in favor. I think it's a good protection for the patients. But again, if we're not sure where it's happening, can we get those details? Is it happening? If it's, you said, in other states, can we confirm it's happening in Kentucky? Can we see some data that shows maybe that this is necessary, or that we only send it to the institutions who do provide this hands-on availability training? Can we, instead of, again, just maybe creating a new program by this, can we just recognize what's happening?
So I think part of the problem when it comes to the data that you're specifically requesting, which would be wonderful if we had it, but to my understanding, the reason that we don't have this is because, and please correct me if I'm wrong or if there's something you want to add to the conversation, is that that's not logged. It's not logged. If you were to be in surgery and under anesthesia, it is not logged in your medical chart that you were given a pelvic exam by a med student while you were in there. So we don't have any way of tracking that from a systems standpoint, if that makes sense.
Jared, follow-up? I have a follow-up. So obviously on the patient end, they wouldn't know. But I would say the institutions that the instruction is being facilitated through would know if that's what they're doing. If they're putting their students in this environment to perform these operations, they're getting some kind of credit for it, or a lab credit for their school. There's something there's a reason that they're going into the surgeries to do this hands-on procedure as part of a curriculum. That's where I'm looking at. It's more of a curriculum, because if he's saying his daughter isn't experiencing this, it's not part of their curriculum. Maybe other states it's part of her curriculum, part of a lab credit, something like that. That's the angle I'm taking, is from the institution part.
So I can't speak to what is happening with Representative Sharp's wife and where she works and who is and is not participating in those training opportunities. I think what's so problematic about it is that you have physicians who don't see this as problematic. They see it as just, this is the way we've always done it. This is part of that hands-on experience of giving students the opportunity to perform these exams. And then you have doctors who are completely uncomfortable with it. But the individuals who have really been sounding the alarm are our med students. Those are the ones that across the nation are speaking out against this issue and feeling that this is a violation of patients' rights. And it also puts them in an incredibly compromising position when you're a med student and you're trying to get an education, to have that power dynamic between an attending physician, somebody who's your superior, who's asking you to do, an exam when you know that the patient has not been given consent. It puts them in a very uncomfortable position. And some students have outwardly said, no, I'm not comfortable doing it. There was one student who was in the PBS segment who said that she said, I froze when I was asked. And because the physician, her attending physician, was behind her, she said, I turned around and when they asked, did you do it? She said, I just lied and said that I did. Because it puts students in a position where they don't want to have to tell an attending, a superior, somebody who's over their educational needs, no, and deal with potential consequences.
Okay, thank you. Rep Raymer, I'm going to let you have the final word, and we're going to have to take the vote here.
So I just want to make a couple comments. I've talked to the lady about this bill quite a bit as she has been preparing it. So I just want to speak to the consent question that has talking about how specific it is. I can't speak for every facility, but I would say most have a process where you have a consent form that you go in and edit, and you make it as precise as possible to explain the procedure and explain what's happening. And somebody can always say no. That's, part of informed consent. It does not mean that they have to do this. The patient has the right to say no. And I hope this isn't happening anywhere in Kentucky. That would be wonderful. But it doesn't bother me to vote on this legislation and pass it without knowing that it's happening, because I do see this as a protection, where patients know what's happening and they can make that choice of whether they want to do it or not. So I just wanted to add that.
Okay, thank you so much. All right, DJ, please take the roll.
Representative Bentley? Yes, sir. Representative Bratcher? Yes. Representative Bray? Representative Burke?
Yes.
Representative Callaway?
Yes.
Representative Camuel?
Yes.
Representative Dotson?
Yes.
Representative Duval?
Yes.
Representative Frazier Gordon? Representative Justice? Representative Neighbors?
Yes.
Representative Rayburn?
I'd like to explain my vote, please.
Okay.
I appreciate this bill. It's really interesting to me that this is even a situation. You've got 5 million people, you noted, that have had treatment or been part of a checkoff for a program, and it's not in their medical chart that this is happening. I don't even know how this is ethical, so thank you for the bill, and I'm a yes today.
Representative Raymer?
Yes.
Representative Riley? Yes. Representative Rourks?
Yes.
Representative Sharp?
Explain my vote.
Yes.
Thank you. I'm going to pass today. I just, if we're trying to preempt this from happening in Kentucky, I understand that, and I'm all for an ounce of prevention's worth a pound of cure type of approach to it. I'm just trying to understand more, and I'm willing to work with you about maybe an amendment, a floor amendment down the road. So I'm going to pass today. Thank you.
Representative Wilner? Representative Whidden?
Yes.
Chair Mosier?
Yes. Okay. House Bill 252, as amended by the House Committee Sub, passes with favorable expression, 15 yeses and 1 pass. Thank you so much. I appreciate it.
Thank you all so much. And I will say, if anybody has additional questions, please follow up with me. Dr. Russell Farmer, who is with U of L, he is a physician as well as an instructor, was willing to come and be part of the testimony for this, but just due to the short notice, he wasn't able to make it for his schedule. So I'd be happy to connect anybody with him who's interested in speaking to him personally.
Okay.
So
thank you so much. Thanks.
Thank you all so much.
Representative Whitten, do you have, you need to record a vote?
I need to record my attendance and
a few votes.
Okay,
So-
please go ahead.
Yes, so for House Bill 170, I'm a yes. 764, yes. 89, yes.
Okay, thank you. Is there anyone else who needs to record a vote? I don't think so. Okay. Okay, next, I would like to invite Representative Callaway and Representative Fraser Gordon to discuss a resolution.
Thank you. I'm Representative Deanna Fraser Gordon, Madison County District 81.
Representative Emily Callaway, District 37, Jefferson and Bullitt.
Okay, thank you. Please proceed.
So the impetus of this bill came from some conversations we've had over lunches and that type of thing, and we got to talking about, have you ever really looked at the labels of the food that we're consuming? And there's been some recent articles to that effect. And so the purpose of this resolution is really just to create awareness around the foods that we consume and to urge the Food and Drug Administration to mandate and enforce a prohibition on United States food manufacturers that produce or sell food containing harmful ingredients that have been banned by several other countries. For example, Skittles, Coffee Mate Creamer, Frosted Flakes, Fruit Loops, and Mountain Dew are all banned in other countries. Fanta is also banned because of orange flavoring. And, with all things, poison is in the dose, but most of these foods are also designed to be overconsumed. So it's just kind of crazy when we think about what's allowed to be produced in the United States and what's not allowed in other countries. And so it's our goal just to bring this more to the forefront so we all can, try and live a more healthy lifestyle and just be more aware about what we're consuming on a daily basis.
We have a motion on the resolution. Second? Okay, we have a motion and a second. Is there anything else that we're missing that you need to elucidate?
No, I think she did a great job. I shared a personal anecdote with somebody that came and testified regarding some medication for children who were struggling with obesity, and I don't have a problem sharing that to give you guys a little bit of behind the scenes about how the focus started in my life anyway, very, very briefly. So I have psoriasis. I've been diagnosed with psoriasis, and I was diagnosed with that in my early teenage years. And they sent me to a dermatologist. I did everything they said, down to smearing what was essentially oil on my skin. It was charcoal oil. It was awful. It was miserable, especially for a teenage girl. And to be told by a dermatologist that I could have it all over my face and my scalp, my tongue, it was just really unpredictable. There were a lot of unknowns. And since I started paying attention to labels, I did my own research, and I started paying attention to labels. I have not had an incident where I had a patch in decades. And it was because I figured out that the trigger was red dye. And that was, I would take an oath about it. I narrowed it down. I examined all the things in my diet, went around, and red dye has been the source. And even with my kids, red dye has been a source of some of their medical conditions over the years, just behavior we learn really young. This is important. What we put in our body is extremely important. And we have people who are responsible for that. And they're just not doing their job, quite frankly. That's it. Thank you.
Okay. All right. Thank you. Representative Raymer.
I just want to make a quick comment before people start saying that we're trying to get the FDA to outlaw Skittles and Cheetos. This, there are other ingredients that can be used to make those foods. And so we're just asking for them to ban those ingredients that we know have these negative, results. It's very clear. It affects children, it affects psoriasis, all different types of things. So we're not asking for these foods to be outlawed. We're just saying let's use healthy ingredients. Thank you.
Yes, thank you for that clarification, because there's different ingredients, so they can still be made just with a different formula.
Absolutely. And I would even say I'm looking at Heinz tomato ketchup, literally bought a bottle from the UK and a bottle from the United States. The first ingredient in ours is tomato concentrate, and the first ingredient in theirs is tomatoes. And so, we always want to support our farmers, and we want the real food in our food, and I don't think that's too much to ask. So, and it can absolutely be done because it is being done in other countries. So
Thank you. Thank you for that. Okay. Secretary, please take the roll.
Representative Bentley,
Okay.
Thank you. Thank you, Lee.
Thank you.
Representative Bratcher, Representative Bray, Representative Burke,
I'd like to explain my yes vote. I'm encouraged by this legislation. Thank you for bringing it. I would like us to not depend on the FDA to get the job done. There are states like California which have taken the next step. I'd love to see us do the same. Thank you.
Representative Callaway,
Aye.
Representative Camuel,
Yes.
Representative Dotson,
Yes.
Representative Duval,
Yes.
Representative Frazier Gordon, Representative Justice, Representative Neighbors,
Yes.
Representative Rayburn,
Yes.
Representative Raymer,
Yes.
Representative Riley, Representative Rourks,
Yes.
Representative Sharp,
Aye.
Representative Wilner, Representative Whidden,
Yes.
Chair Mosier.
Yes. Okay. House Concurrent Resolution 103 passes with favorable expression, and the same should pass on the House floor. Thank you so much. The next bill we're going to take up is House Bill 438. Representative Sherilyn Stevenson and I think Representative Bentley. Thank you so much. Make your way to the table. Introduce yourselves for the record.
Thank you, Chairwoman. Sherilyn Stevenson, State Representative, the 88th District.
Thank you, Chair Mosier. Julie Babbage Longani, and I'm here on behalf of the Diabetes Patient Advocacy Coalition.
Thank you.
Representative Danny R. Bentley, District 98 of the Great Commonwealth of Kentucky.
Well, thank you so much. This bill was actually on the agenda last week and had to be pulled at the very last minute. The Board of Pharmacy had a few issues. Those have been worked out in a committee sub, so we will need to adopt that.
Okay. We have a motion and a second to adopt the sub. All in favor, please say aye.
Aye.
Any opposed? Okay, please proceed.
Thank you. Colleagues, what you have before you in House Bill 438 is legislation allowing schools across the state to store an undesignated supply of glucagon to treat students with diabetes in an emergency. By ensuring schools across the state.
Okay, we have a motion and a second on the bill. Do we have any questions? All right, seeing no questions, DJ, please take.
Representative Bentley,
Yes.
Representative Bratcher, Representative Bray, Representative Burke,
An enthusiastic yes.
Representative Callaway,
Aye.
Representative Camuel,
Yes.
Representative Dotson,
Yes.
Representative Duval,
Yes.
Representative Frazier Gordon, Representative Justice, Representative Neighbors,
Yes.
Representative Rayburn,
Yes.
Representative Raymer,
Yes.
Representative Riley,
Yes.
Representative Rourks,
Yes.
Representative Sharp,
Aye.
Representative Wilner, Representative Whidden,
Yes.
Chair Mosier.
Yes. Okay. House Bill 438, as amended by the committee sub, passes with favorable expression, 16 yeses, no nos, and the same should pass on the House floor. Thank you.
Thank you, Madam Chair. Thank you. Thank you for your help, Rep. Bentley and Julie. Thanks.
Thank you. Okay, I am going to make my way to the table and hand over the gavel to my trusty vice chair.
Next bill we'll be hearing is House Bill 766 with Rep. Moser. As you make your way to the testimony table, please introduce yourself and your guest, and you may begin.
Wonderful. Well, thank you so much for the opportunity to discuss House Bill 766. We have several guests here today. I am Representative Kim Mosier. I represent the 64th District.
Leslie Sizemore. I'm Associate Vice President for Workforce and Economic Development for the Council on Post-Secondary Education.
I'm Dale Bertram. I'm from Hebron, Kentucky, and I'm representing the American Association for Marital and Family Therapists.
And I'm Representative Deanna Fraser Gordon, District 81.
Okay.
We do have a committee sub.
Yes, we.
Do I got a motion and a second? All in favor of the sub, say aye. All in disfavor, say no. Looks like it passes.
Thank you so much. This bill, 766, is a combination. We ended up merging three bills, actually, that all had similar provisions, especially House Bill 780 and 766. They simply collect data around our healthcare workforce, and we don't have a clear picture of who may be retired, may not be working in the clinical space any longer. We know who's licensed, but we need a little more data to actually dig down on our healthcare workforce issues. That's really all this does. We just need more specific data around our licensed professionals to better understand the shortage. Representative Fraser Gordon, I don't know if you want to add anything about the merging of these 766 and 780.
So a lot of the fields that Rep. Mosier was collecting in her bill, when I saw the agenda, my bill was doing a similar thing for a different purpose. So mine was more in regards to insurances and networks. You know, we talk about healthcare shortages, and we just don't know who is practicing where and doing what. And so we could kill two birds with one stone, as they say. And so by collecting this data and having it in also a more regulated format, each licensing board has their own process. Some of them still use paper forms. So this is just creating an online process so that data can be in a format so it can be used for multiple purposes.
The reporting piece of this is moving. We originally, in my bill, 766, had the report going to the Office of Kentucky Center for Statistics. We have maintained that, and I believe I know the Cabinet now, the Cabinet for Health and Family Services, is the other entity who will receive this data, summarize it for us, and share it so that we will have that. And also our friends with the Council on Post-Secondary Education have this to work on things like work-ready scholarships and so forth. So, Leslie, would you like to add anything?
Absolutely. In my role with the Council on Post-Secondary Education, I'm charged with making sure that we're supporting post-secondary education institutions to be able to fill the talent needs of our industry partners. Healthcare being our largest industry deficit in the state, and we're still really in crisis mode with that, workforce development right now. We're focusing a lot on the need for data so that we can make informed decisions about whether or not we have adequate talent to fill particular healthcare roles. This was brought to my attention recently when we asked some folks from Medicaid to come over and talk to us about the data report that they renewed or they further developed from Deloitte, which happened way back in 2013. So we didn't have any new data until this report. And when they gave us the report, it was all about nursing. We could find out everything we needed to know about nursing. We knew how many nurses we had, who was practicing, who was retired, who was working in specialty areas, but we did not have that for anyone else. We didn't have it for physicians, we didn't have it for therapies. And so this bill will allow us to be more innovative and will allow us to really revisit the process and improve upon that.
Okay, thank you. The last part of this bill deals with marriage and family therapists. We have a shortage of marriage and family therapists here in Kentucky, as we do with other healthcare workers. And this provision will allow out-of-state marriage and family therapists who have undergone the same postgraduate training and have passed their licensure exam to apply for a license here in Kentucky and be recognized as having the same credentials. And if they meet all of those eligibility requirements, would pay their fee and would be issued a marriage and family therapist license. Would you like to add anything to that, or?
No, I think that you covered it very succinctly, and I think the only thing I would add would be that several of our neighboring states have already passed similar legislation. In Ohio and Indiana, Virginia and Tennessee is in process now.
Perfect, thank you. We're happy to answer any questions that anyone might have, and if not, move passage.
Seeing no questions, I have a motion and a second. DJ, call the roll, please.
Representative Bentley? Yes, sir. Representative Bratcher? Yes. Representative Bray? Representative Burke?
Yes.
Representative Callaway?
Aye.
Representative Camuel?
Yes.
Representative Dotson?
Yes.
Representative Duval?
Yes.
Representative Frazier Gordon?
Yes.
Representative Justice? Representative Neighbors?
Yes.
Representative Rayburn?
Pass.
Representative Raymer?
Yes.
Representative Riley? Yes. Representative Rourks?
Yes.
Representative Sharp?
Aye.
Representative Wilner? Representative Whitten?
Yes.
Chair Mosier?
Yes.
Okay, House Bill 766 passes with 15 yeas and 1 pass vote. The same should pass on the House floor. Thank you, Representative Mosier.
Thank you. Okay. Thank you all. Thank you.
677. Mr. Mosier will stay at the testimony table. We're going to take up House Bill 677.
Okay. Well, thank you. Again, I am Representative Kim Mosier. I represent the 64th District, and I am happy to talk about this simple clarification, really. House Bill 677 simply requires that health insurers and MCOs or managed care organizations comply with the Kentucky Any Willing Provider law, which says a health insurer shall not discriminate against any provider who is located within the geographic coverage area of the health plan and is willing to meet the terms and conditions for participation established by the health insurer. That is including the Kentucky State Medicaid program and any Medicaid partnerships. As a point of clarification, this bill adds a medical laboratory that is licensed in Kentucky to the list of providers covered by the Any Willing Provider law. There have been some situations where patients haven't been able to access laboratory services in certain areas of the state because of some, it seems discriminatory without any communication, and so this just clarifies that those medical laboratories would be part of the Any Willing Provider law. So happy to answer any questions.
I got a motion with Representative Bratcher, a second with Representative Bentley. Any questions? Seeing none, DJ, please call the roll.
Representative Bentley? Yes. Representative Bratcher? Yes. Representative Bray? Representative Burke?
Yes.
Representative Callaway?
Aye.
Representative Camuel?
Yes.
Representative Dotson?
Yes.
Representative Duval? Yes. Representative Frazier Gordon? Yes. Representative Justice? Representative Neighbors?
Yes.
Representative Rayburn?
Yes.
Representative Raymer?
Yes.
Representative Riley?
Yes.
Representative Rourks?
Yes.
Representative Sharp?
Aye.
Representative Wilner, Representative Whidden,
Yes.
Chair Mosier.
Yes.
This bill passes unanimously, and the same should pass on the House floor. I do thank you, Representative Mosier. We got regs? Oh, yeah. I was about ready to motion us on out of here. We ain't done yet, committee.
Okay, we do have some regs that all of the members have received and should have had time to review. We do have some folks here to discuss one of the regs, and I will invite Heidi Lanham, and I guess you're on your own, right? Okay, perfect. Okay. If you just want to introduce yourself for the record, explain what your concerns are, and we will proceed.
Good afternoon. I'm Heidi Schisler-Lanham. I'm the legal director at Protection and Advocacy. We're an independent state agency, one of only 3 in the nation anymore that is still a state agency that advocates for the rights of persons with disabilities throughout the Commonwealth. It's very rare that I come to you all for a regulation. That's because there are so many times when one can comment on a regulation and get changes made to a regulation before it makes it to you all, the subject matter committee. This regulation is about the state health plan. It's created for 3 years and updated annually. During its last update, in the midst of its last update, you all passed House Bill 344 or 334. I'm dyslexic, so I'm always mixing up numbers, which added criteria that needed to be in the state health plan for ICF's IID. Those are intermediate care facilities for individuals with intellectual and developmental disabilities. So in the midst of this update, you all passed a law that said you needed to add these 4 criteria to the state health plan. They are not in the state health plan. We commented to the Office of the Inspector General in the midst of it going through the process. They said they were not going to add it. We appeared last month at the Administration Regulation Review Subcommittee, or ARS. We understood that we had an agreement that they were going to add that. I met with the Office of the Inspector General, actually Inspector General last week, and others in his office, and they said they would not add it. So I'm here today with that issue.
Okay, thank you. All right, Inspector General, I'm sorry to put you on the spot, but would you mind just making your way to the table? I just have a couple of questions. And maybe you could just explain your position and what you've worked on and what the resolution has been.
Yes, of course. Thank you, Acting Inspector General David Lovely. So in the update to the state health plan, we did in the ours committee meeting discuss with Ms. Lanham that we would explore language, and we did. We met, and our position is simple. The statute, it's now codified as 216B 178, and the statute it doesn't say add to the state health plan. It just says it shall be consistent with the state health plan. The state health plan is part of a regulation, which is, obviously why we're here, 900 KR 5020. Statute supersedes regulation. It would just be a redundancy. And we didn't want to make any more additions to the state health plan. This has been ongoing since July of 2023. And as we explained to Ms. Lanham, the comment period for the new update to the state health plan will be within the next month or so, couple months, and that we could explore any language additions in that plan.
Okay, thank you. That helps me understand kind of what's happened, and it sounds like there are some opportunities coming up to continue the discussions. Is that correct?
Yes, of course, Chair.
Okay. Okay. All right. I don't have any further questions. Are there any other questions from members? Okay. Representative Brooks.
Ms. Lanham, I just wanted to give you the chance to respond. Is that something that you think should be addressed at a later time, or is there still further comment about why this is not meeting the need?
Well, when an application to take these ICF IID beds is filed, a hearing officer will look at the requirements and will look at the state health plan and whether or not it meets the state health plan. If those requirements are not in the state health plan, I guess I'm going to be asking a hearing officer, now you need to go outside of the state health plan and look at the statute. It should be in the state health plan. It's very easy to do. There's a batching cycle for all kinds of beds for the certificate of need, and there's a batching cycle that's going to start on June 26th, and I would very well assume that one of the two private ICFs is going to be coming in and asking for the public beds. There's another issue in that the statute uses the term non-governmental entity, and the new language, the only language that they added was to add state operated. There aren't any state operated ICFs anymore. All of the, what I consider a public ICF, they are contracted through CMHCs and a private company. So even that language is incorrect. It would be, the language is right in the statute. You just have to cut and paste and put it in the state health plan. There's nothing to really discuss. It would be simple to do and do it quickly.
Inspector General, do you have any comments? Is it simply aligning with the statute to put this in the state health plan?
So the statute is going to supersede the state health plan. Hearing officers, the situation that Ms. Lanham is referring to, hearing officers have to review every statute anyway. They're bound by the statutes. The KRS are superseding the state health plan. So they would have to follow this anyway. And our position is just that it's just a redundancy to put in the state health plan something that's already required by Kentucky revised statute.
Okay. Well, I mean, I'm not sure what the impasse is here at this point. It sounds like there's an avenue to clarify if we need to do that. I don't quite know why it would be problematic, I guess, to have that redundancy if it's clarification.
I understand your position, Chair Mosier, and we'll certainly do what the committee wants us to do. Again, where this has just taken a long period of time to get this state health plan passed, we're going to be going up on close to a year soon, and we're just we had some language in that we were before the Senate Health Services Committee that the committee did not approve of, and they let it be known. And so we're just trying to get this through, and I think that's our position. But certainly if the committee feels as though we need to make an addition, we'll do what the committee wants us to do.
Well, I mean, and I understand the length of time that we've been working on this administrative reg, and there have been things that have been added and pulled and clarifications made, and I too would like to just get this through and allow for, if there are some other clarifications to be made, to maybe have you do that through the public comment period. I don't want to slow down the state health plan process here. So, do we have any questions? Representative Bratcher?
Yes, ma'am. Is this issue causing your organizations, and I appreciate what your organizations do. They represent a very underserved population, and the reimbursement for that is very low from the state. But do you have any issues this is causing you concern for some reason? It's causing you not to be able to function as you would, or is it causing you less regulation? What's the issue?
No, not at all.
Okay,
we represent individuals with disabilities
Right.
who might end up living in an ICF IID. Generally, most people with disabilities want to live in the community So we are always arguing for or advocating for more community-based services. And when services are going to be delivered in an institution, we want to keep an eye on that and make sure that all the rules are followed of those institutions and that those people are safe there. So, as I said, in June, when the next batching cycle comes around, one of the two private ICFs will probably be asking to enlarge themselves by taking some of what I call the public beds and building new, smaller ICFs on their grounds. And we just want those rules in there for the Cedar Lake Lodge and Wendell Foster's when they file those, that they know that they've got to follow these rules per the statute.
So OIG has already indicated that these rules are in statute somewhere else.
They are.
So if we went ahead and passed this today, it wouldn't have any effect one way or other with you all. Is that correct?
That's a hard question to answer. No, it would not affect us.
Okay.
No, sir.
All right, thank you.
Okay, thank you. All right. We have an agency amendment for 900 KAR 005020, which we just discussed. We have, I think, discussed this, so I'll entertain a motion. Okay, a motion to accept the amendment, and we have a motion and a second. All in favor, please say aye. Aye. Any opposed? Okay. All right, so we have passed the agency amendment. And are there any other questions about any of the other administrative regs? Okay, seeing none, I will consider those reviewed. Okay, thank you so much. I appreciate your time and your work on this. I know it's been a long summer and fall trying to find some reconciliation, so thank you for your work. And thank you, Heidi, for coming and discussing this.
One question.
Sure.
I'm sorry. Agency amendment is to just add the statute into the state health plan?
Not as it pertains to your issue.
Okay, this was another issue. Okay,
It's
I
another
thought all
issue.
of a sudden I'd somehow won.
Well, you
I'd
win
been
in
that
our
persuasive
book,
that-
so, all right, thank you. I
Okay.
appreciate it.
Okay, thank you.
All right,
Thank
see
you.
no further business, we are adjourned.